Hi, Assalamualaikum. My name is Tunani Farzana and we'll be discussing about a rare case study of pseudomagang renosum with dilated cardiomyopathy and multiple cerebral infarct in malnourished children. Before we going into further, this case study discusses a rare pediatric presentation of pseudomagang renosum (PG) complicated by dilated cardiomyopathy, which known as DCM, and multiple cerebral infarctions in the context of severe malnutrition. What is PG? PG is a rare, non-infectious ulcerative skin disease, especially uncommon in children, and its co-occurrence with DCM and related events in malnourished children. Let's go further into what is DCM. It is a condition where heart's main pumping chamber, left ventricle, become enlarged or dilated and weakened, which makes it harder for the heart to pump blood effectively to the rest of the body. Next is patient information. The patient is a 10-year-old boy who presented to the pediatric emergency department with severe bilateral leg ulcers. He had a known history of dilated cardiomyopathy and had experienced 4 previous episodes of transient ischemic attacks. On examination, he was found to be severely malnourished with a body weight of 25 kg, a height of 132 cm, and an arm circumference of 16 cm. His body mass index BMI for age was negative 1.51 standard deviation and his height for age was negative 1.05 standard deviations, which classifying him as having severe wasting. Upon admission, the child was moderate ill but fully conscious with a heart rate of 148 beats per minute, respiratory rate of 24 breaths per minute, and a body temperature of 36.8 degrees Celsius. After multidisciplinary treatment, including antibiotics, anticoagulants, and nutritional support, the patient showed significant improvement and was discharged at a body weight of 28 kg for continued outpatient care. Let's moving forward on case study issue. Firstly is primary diagnosis, pseudomagang renosum, complications, dilated cardiomyopathy with thrombi in left and right ventricle, multiple cerebral infarcts, coagulation abnormalities, severe malnutrition, and bacterial superinfection, Pseudomonas aeruginosa and Citrobacter frundi was found on the patient. The outcome of this case is clinical improvement in cardiac function, coagulation markers, nutritional status, and skin lesions after 1 month. Besides that, we will go to the treatment. So there are 4 treatments for the patient. Firstly is combination antibiotics, which is cefotaximab and metronidazole. And secondly is surgical, which is necrotomy debridement 3 times. Thirdly is anticoagulants warfarin. And lastly is supportive therapy of booming diuretics. Next is echocardiography findings or parameters. So firstly, in figure 1, A shows multiple necrotic ulcers with granulation fast and slow on the lower limbs, and this indicating cutaneous manifestation of pseudomagang renosum. In figure 1B displays the improved wound condition of the treatment, which known as post-necrotomy and antibiotics. Moreover, in table 1 shows outlines the timeline and progression of clinical manifestations, including the appearance of lesions, fever, and necrosis. This indirectly supports the worsening of the systemic condition that aligns with cardiac dysfunction and poor perfusion. Secondly is figure 2 shows chest X-ray, which demonstrates cardiomegaly with a cardiac thoracic ratio of 78%, which is a key indicator of dilated cardiomyopathy, DCM. Thirdly is figure 3 echocardiography shows dilated chambers, reduced left ventricular ejection fraction 32% and a thrombus 14 × 37 mm in the left ventricle. This confirming DCM with intracardiac thrombus. So there are 3 pictures here. Firstly is picture parasternal short axis view papillary muscles. Secondly, parasternal long axis view. And lastly is apical 4 chamber. Furthermore, figure 4 shows X-ray of lower legs, reveals soft tissue irregularity, ulcer formation, and a lytic sclerotic lesion at the left calcaneus. Although not cardiac related, These findings highlight complications from poor perfusion and infection, which likely exacerbated by cardiac dysfunction. Meanwhile, for Figure 5, which shows USG color Doppler, shows mild to moderate stenosis at the bilateral dorsalis pedis arteries, which may be due to poor peripheral circulation related to DCM-induced low cardiac output and thromboembolic events. Other than that, Figure 6 biopsy of lesion confirms histopathological features consistent with pyoderma gangrenosum, which helping differentiate from other ulcerative or infectious conditions. This is not cardiac but confirmed diagnosis. Meanwhile, for Figure 7, follow-up echocardiography reveals improved cardiac function, no thrombus, and normal ejection fraction, which following medical treatment, anticoagulation, and nutritional support. Lastly, of echocardiography findings of parameters, in Figure 8 shows second MRI of pig shows multiple white matter lesions in juxtacortical frontoparietal areas, suggestive of multiple sclerosis, though potentially overlapping or unrelated to the cardiac pathology. Lastly is Figure 9. This shows course of illness, which illustrates a timeline of disease progression and treatment interventions, including episodes of cerebral infarcts, necrotomy procedures, and clinical improvements, which corresponding with improvements in cardiac function is shown in Figures 3 and 7. Before we end our session for today, there is 4 additional information that related to the topic. Firstly is biopsy, confirm possibility of PG, histological findings consistent with neutrophilic dermatosis. Secondly, MRI and angiography, which is thrombosis in cerebral sinuses and multiple infarcts, which suggesting embolic phenomena secondary to intracardiac thrombi. Next is causative bacterial, cultures group Pseudomonas aeruginosa and Citrobacter frundi, which both resistant to common antibiotics, this indicating the need for targeted antimicrobial therapy. And lastly is pathophysiology insight. DCM likely contributed to thrombus formation and impaired circulation. This can increasing the risk for PG and poor wound healing, which exacerbated by malnutrition and infection. In a conclusion, this case study shows that pyoderma gangrenosum in the child can become much worse when combined with other serious conditions like dilated cardiomyopathy and poor nutrition. The heart problem caused poor blood flow and blood clots, which led to more damage in the body, including stroke-like symptoms and slow wound healing. The child malnutrition also made it harder for the body to fight infection and heal. With early treatment using antibiotics, blood thinners, wound surgery, and better nutrition can improve patient. This case highlights the need to treat both the skin condition and the underlying health problems at the same time.